Hey there, and welcome to This Explainer. If you're navigating the complexities of male fertility, you are definitely in the right place. Today, we're acting as your supportive, reassuring guide to understanding Klinefelter syndrome. We'll be drawing on some excellent, really straightforward insights from ART Fertility Clinics to break down exactly what this condition is and, more importantly, what it actually means for your path to building a family.
Here's our quick roadmap for today. We'll start with what is Klinefelter syndrome, then look at spotting the symptoms, followed by getting a clear diagnosis, and we'll wrap up with pathways to fatherhood.
All right, Section 1. What is Klinefelter syndrome? When you first hear medical terminology, especially anything related to genetics, it can sound incredibly intimidating, right? But if you're struggling with male infertility right now, the absolute first thing you need to hear is this: you are not alone. Finding answers to infertility is a journey that so many men and couples navigate every single day. It can feel really isolating, but the truth is, conditions that affect male fertility are far more common than most people realize. It's a shared hurdle, and there's absolutely a whole community of support and medical expertise out there ready to help you. To put this into perspective and give you a real sense of just how common this is, look at this stat from the National Human Genome Research Institute. 1 in every 500 to 1,000 newborn males has Klinefelter syndrome. Think about that for a second. That means in any average-sized town or even just a large high school, there are guys walking around with this condition. It's not some ultra-rare anomaly. It's actually a pretty frequent genetic variation. So what exactly is it? Well, Klinefelter syndrome, or KS for short, is basically a genetic condition where a guy just has one extra chromosome. Usually, a person has 46 chromosomes, but in KS, there are 47. So the crucial point here is that this isn't an illness or some disease you catch. It's literally just a slight difference in your genetic blueprint right from day one. It's a microscopic addition, just one extra chromosome, that leads to the symptoms we're going to talk about next. And here's what's really fascinating. A lot of males with KS have absolutely zero significant symptoms. None. Or maybe just a few super mild ones. You could be going through your whole life, school, sports, building a career, without ever knowing about that 47th chromosome. Because it doesn't always show up as a severe health issue, it often goes completely undiagnosed. For a lot of men, it's kind of like a hidden hurdle that only really pops up when they try to conceive a child and suddenly run into roadblocks. Moving right along to Section 2, spotting the symptoms. Now, even though some guys don't have obvious signs, others definitely do notice certain physical or developmental traits. And we have to remember these can vary wildly from person to person. No two cases are exactly alike. So to really understand this, we need to look at a timeline. Symptoms actually evolve as a guy grows. What you see in a baby is way different from what you see in a teen, which is different again from an adult. So we're going to break this down chronologically: babies, boys and teenagers, and finally adult men. Starting with babies. In infancy, the signs are usually super subtle. We're mostly talking about mild physical and developmental delays. A baby might have slightly weaker muscles or maybe just reduced overall strength compared to other babies. Parents might also notice a little delay in when they start speaking. But these are so mild, they often just get chalked up to normal developmental variations, which is exactly why it's so rarely caught at this stage. Okay, let's see how this builds in boys and teenagers. During the adolescent years, physical proportions and puberty become the big indicators. Boys with KS might end up growing taller than average, often with longer legs and a slightly shorter trunk. They might also hit puberty late or sometimes not really at all. Other things to look out for are a smaller penis, weaker bones, and just generally low energy. But again, teenagers' bodies are changing so fast anyway, right? So even these signs can easily be dismissed as just an awkward growth phase. And finally, we reach adult men. This is where the signs become much more tied to reproductive health. We're looking at things like small testicles, a lower sex drive, maybe less facial and body hair, and sometimes enlarged breast tissue. But the absolutely crucial symptom here, and usually the main reason men finally go see a doctor, is having a low sperm count, or sometimes literally zero sperm in the ejaculate. When a couple is trying to start a family and it's just not happening, this is the red flag that triggers the medical investigation and finally brings KS to light. Which brings us to Section 3, getting a clear diagnosis. Okay, let's dive into this next phase. If any of those symptoms rang a bell, or if you've been struggling to conceive, seeing a specialist is the next logical step. And I really want to totally strip away any anxiety you might have about this doctor's visit. Diagnosing KS isn't some huge guessing game. It's a very clear, established medical procedure. It basically just comes down to 3 straightforward steps. Step 1, A standard physical exam and a chat about your symptoms. Easy enough. Step 2 is hormone testing, usually just a simple blood draw to check your testosterone levels. And step 3 is a chromosome analysis, also known as a karyotype. It's just another blood test that literally looks at your chromosomes to spot if that 47th one is there. It's a highly accurate, standard process. Once those results are in, you have absolute clarity. And I really, really want you to take this next part to heart. A diagnosis is not the end of the road. Literally, far from it. Actually, scratch that. It's the beginning of your family building strategy. You know, when you're dealing with infertility, the unknown is always the scariest part. Finally, putting a name to the problem is incredibly empowering. It means your doctors don't have to guess anymore. They know exactly what they're dealing with, which allows specialists, like the folks at ART Fertility Clinics, to give you highly targeted, effective solutions. And that leads us beautifully into Section 4, Pathways to Fatherhood. This is where we turn that knowledge into action. For guys with Klinefelter syndrome who want biological kids, modern medicine offers immense hope. The treatments we have today are honestly a real game changer. First up is something called ICSI. That stands for intracytoplasmic sperm injection. It's an incredible, advanced treatment specifically designed to overcome severe male infertility. So instead of needing millions of sperm to naturally fertilize an egg, ICSI literally requires just one. An embryologist takes a single healthy sperm and injects it directly into the egg in a lab. For men with KS who might have incredibly low sperm counts or who need sperm retrieved directly from the testes, ICSI is a total lifesaver. It entirely bypasses the need for naturally high sperm counts. Now, the second crucial tool in this process is PGT, or pre-implantation genetic testing. Because KS is a chromosomal condition, it's totally understandable for couples to worry about passing chromosomal issues onto their kids. Well, PGT is a test done on the embryos created through IVF and ICSI right before they're implanted in the uterus. It lets doctors carefully screen those embryos to make absolutely sure they have the right number of chromosomes. Think of it like a safety net, ensuring you're moving forward with a genetically healthy embryo. What's really cool is how these two treatments fit together like a giant puzzle. You've got ICSI on one side, solving the physical hurdle of having low or zero sperm. That creates the embryo. Then you've got PGT on the other side acting as your quality control, making sure those resulting embryos have perfectly healthy chromosomes before a pregnancy even starts. Together, they perfectly complement each other to tackle the specific dual challenges of Klinefelter syndrome. And this brilliantly illustrates our ultimate takeaway today, straight from the experts at ART Fertility Clinics. They state, fertility treatments such as ICSI combined with pre-implantation genetic testing can help men with KS to have healthy babies. Seriously, let that sink in for a second. An extra chromosome does not have to be the end of your dream of becoming a father. Biological fatherhood is absolutely possible, and fertility clinics are successfully helping men with KS build their families every single day.
So, if you've been carrying around the heavy weight of a Klinefelter syndrome diagnosis, or if you kind of suspect it might be the missing piece to your own fertility puzzle, I really hope this explainer showed you that there is a clear, incredibly hopeful path forward. Please, don't let fear hold you back. Reach out to a fertility specialist, get the test done, and start building a strategy that works for you. The science is there, the support is definitely there. So the only question left is, knowing that advanced medicine has paved the way, are you ready to take the next step toward fatherhood?